Hello and welcome to the Amplifying Scientific Innovation podcast. I'm your host, Dr. Sophia Onoye, founder and CEO of the Sophia Consulting Firm, a life science marketing and communications consultancy that was established in New York City with the goal of amplifying scientific innovation. The goal of this podcast is to showcase scientific innovation stemming from global life science companies through conversations with senior leaders who share their unique leadership journey, corporate vision, and industry outlook. My guest today is Professor Oded Shoseyov, a faculty member of the Hebrew University of Jerusalem and the chief scientist of CollPlant, an Israeli regenerative and aesthetic medicine company that recently announced expansion of its partnership with United Therapeutics to include 3D bioprinting of kidneys. Professor Shoseyov has accumulated extensive experience with plant molecular biology and protein engineering. Notably, he has authored or co-authored more than 180 scientific publications and is the inventor of 50 patents. He is a recipient of several prestigious awards, including the Outstanding Scientist Pollack Award in 2002, the 1999 and 2010 K Award for Innovative and Applied Research, and an honorable mention from the Israeli Prime Minister for his contributions in entrepreneurship and innovation in 2012. In 2018, he was also awarded the Presidential Award for his contribution to the economy and society of Israel. I had the pleasure of virtually meeting Professor Shoseyov when I hosted a webinar for CollPlant earlier this year, highlighting his plant-based human recombinant RH collagen platform for the future of aesthetic and regenerative medicine. I'm also happy to share that the Sophia Consulting Firm has served as CollPlant's agency of record since February this year. It's an absolute pleasure and honor to welcome you to the show, Professor.
It's my pleasure. Thank you very much.
Great. So I usually start with my favorite question, which is, what is your definition of scientific innovation?
Okay, that's a very interesting question. I believe that innovation is actually integration of existed technologies, coming from different parts of science, but the combination is either unexpected or in a way have not been done by others, either because they simply didn't think about it, or because it was really an out-of-the-box way of thinking. To me, that's innovation.
That's remarkable. I like the integration aspect. I think that is very important. And, Professor, you have achieved so much. And I can imagine my second question is like asking you to pick a favorite child. But what would you consider to be your most impactful scientific and professional accomplishment to date?
So you are absolutely right. For me to say it is like say which one is my favorite child. But nevertheless, I will try to be honest about it, and I will have to say that the ability to really clone and integrate 5 different human genes into a single plant and to successfully produce human collagen in plants must be the top of my achievements. Simply because at that time when we started this idea, many people thought that there is no way that it will ever work. And I don't blame them for that lack of trust, if you like, because even I thought that it may be too ambitious at that time. And the fact that it succeeded, still, even today, I have to pinch myself and say, wow,
Wow.
it's quite amazing.
Yeah, I would agree with you. I think that that's remarkable. Transgenic plants and looking at CollPlant and what is going on with the company today, I'm sure it's something that you should be absolutely proud about. So that's great. But then again, it brings up my third question, which is the why. Why did you choose to research plant molecular biology, protein engineering, and nanobiotechnology? What was it that inspired you to do these things?
So actually, that goes back then when I got my PhD. It was a totally different aspect. When I did my PhD on biochemistry of wine flavor, so a lot of organic chemistry and analytical chemistry. In those days, it was late 80s. I started to read about molecular biology and protein engineering, and I became envy of the people that do that. And at that time, I said, "Wow, they're really playing God." And I made a decision that's what I wanted to do. And so, as a postdoc, I decided to really move into this area of protein engineering. Nanobiotechnology actually came later, only 15 years ago. I have to thank our late president, Shimon Peres, who was able to convince my government to invest $500 million in 5 nanocenters in the Israeli universities, and we at the Hebrew University were lucky to receive $100 million and establish nanotechnology. In those days, nanotechnology was dominated, well, probably still dominated by inorganic chemists and physicists. Biotechnology was not perceived as the mainstream. And I came with a ticket that, hey, biotechnology can contribute to the field of nano. And I'm excited that I did it, because that really opens a lot of channels of collaborations with scientists that come from totally different fields, like physics, photonics, inorganic chemists, and that actually one of the most important lessons that I had, that if you try to collaborate with people that are out of your immediate field, I mean, this is really the most important thing that you could do, because the benefit is outstanding.
Like, I love that multidisciplinary suggestion. I think that it makes sense because we all bring different things to the table. So my follow-up question for you is, can you provide a top-line overview of ongoing work in plant-based technology, especially as it relates to regenerative and aesthetic medicine?
So I think that more and more people realize that plants are the best manufacturers. And this was not, I mean, plants were not the immediate choice method of production years ago, because I believe that scientists that, for example, were working on mammalian proteins thought that, hey, it will be easier to produce it by mammalian cells, which is probably true, but the cost of production is enormous. Simply because mammalian cells are very delicate, so they require very special bioreactors, the media you feed them. I came to the conclusions years ago that plants are really the ultimate manufacturers, simply because they're at the bottom of the food chain. I mean, everybody eats plants. Plants don't eat us, you know, and so we really depend on our plants, and so they're really sophisticated. And over the years, technologies, transformation technologies, and more recently, genome editing, you know, CRISPR and others, enabled us to really take those plants and engineer them, not just by simply introducing human genes or maybe optimize codon usage and use sophisticated expression systems, but actually to do metabolic engineering of the plants to make it suitable to produce whatever we want, and doing that with a minimal cost. And when I say minimal cost, it's not just minimal cost to produce, but it's minimal cost to the environment. In fact, every time that a company or a researcher is producing something beneficial, like human collagen or another important protein, vaccine, you name it, in plants, we benefit from the fact that these plants absorb some of the carbon dioxide, release some oxygen to us. So it's really the most sustainable method, beside the fact that it's also very cost effective.
Yeah. I really like the focus on sustainability. I think that is a very important topic, and I'm really glad that you brought that up. So my follow-on question for you is, in your opinion, of course, how has the Israeli biotechnology industry changed in the past 15 years, and what are some loopholes?
So one of the nice things that happened in the early days in Israel was that companies like CollPlant, but also Protalix, really pioneered the production of biopharmaceuticals, if you like. It took them all the way to the marketplace. And one reason for that, I guess, is that if you looked at the Israeli biotech industry, many of the companies choose not to go into, heavy pharma because the cost of the clinical trials, and typically Israeli companies, startups, they never had the strength to go and spend hundreds of millions of dollars in clinical trials. So even so-called biotech companies actually went to the niche of medical device, perceived as an easier way to go. And that to me was a big mistake. I mean, on one hand, companies found themselves either acquired by other big companies, and the early investors made a lot of money, but you have very, very few at all, if at all, Israeli companies that are at the size of, companies like Merck or
Pfizer.
Pfizer. I mean, we have Teva, but it's still there's a lot of innovation. Many companies found and been able to develop really cool technologies, and unfortunately, many of them end up, making. The company was sold for a few $100 million, here and there, a few $1 billion, which was very nice. But as an Israeli industry, we never in the biotech industry never achieved the achievements of the high tech, like Immobilize sold for $15 billion, or and you see huge companies like Click, like Checkpoints. I mean, that became market leaders. And I think that it has to do with the fact that most of the Israeli investors suffer from the fact that biotech industry, unlike the high tech or the cybersecurity business, it's a marathon. It's not
right.
It takes time.
Right.
And so you have to be patient. And I think the Israelis are not that patient.
No, I think you're right on. I don't think that patience is a unique issue with Israel. I think it's a worldwide phenomenon. And part of the reason why I love a platform like this is we get to have great leaders like you that educate on the process. What does it really take to bring in an innovative therapy to the market? It takes time, it takes patience, and it takes investment dollars. So very well said, Professor. So my next question for you is along the same lines. What do you think we could have done differently as an industry to mitigate the impact of COVID-19?
Well, that's a very interesting and I think very important question, because as an industry, I think that we almost didn't give the right attention to the vaccine industry in general. If you look today on the vaccine industry, or maybe not today, but maybe 2 years ago or a year ago, you would see that the people are ready to pay tens of thousands of dollars, even hundreds of thousands of dollars, to get a biologic drug or any other pharmaceutical that will help them, even not totally cure, from disease like cancer, for example. But they're only ready to pay few dollars for vaccine. And the reason is because vaccines are perceived as an insurance. So people are not ready to pay a lot for insurance, because they say, well, we are healthy now, so paying for insurance is like wasting money. Consequently, big companies that are in the business always looked at the vaccine business as a very risky business, most of the time not supported by governments. And despite the fact that the vaccines were developed, I don't know, like from the time of Salk or even before, I mean, this is like a really old established technology. If the governments and the industries were able to, put together a more global plan for vaccination, that maybe even the regulators should put money from the pension funds, I don't know, to support vaccine research, we would have been in a totally different situation today. We are now waiting almost a year to vaccines to be developed, and I think we could have done better. And it is really because it was never perceived as a very profitable business.
Well, I really appreciate your honesty. I think that that is very refreshing. And it's also, again, enlightening because people need to hear the truth about the industry. And that's the best way that we can move forward. Now, my follow-on question for you is there any technology or company that you're currently excited about and why?
So, other than CollPlant, because I'm biased, this is my choice. That's my favorite.
Oh.
But nevertheless, I'm really excited about Caribou, which actually took the technology from Berkeley, for genome editing, because I think that people don't even start to comprehend the power of that technology. And by the way, it's not just genome editing, it's also, the same technology or modification of the technology can be used for diagnostics. I recently read a very interesting article in a New England journal where it's being now the same S-guided RNA technology is now being used to improve detection of COVID-19. And going back to genome editing, this is really playing God, seriously, because honestly, what we have done so far, we designed gene constructs, and in most cases we shotgun those genes into the plant, and it was integrated randomly in the genome. Sometimes, if we were fortunate, it was ended up in a good place, most time in a bad place, and therefore it requires a lot of work to do it again and again and again, and select the one that is okay. It reminds me the time, because I'm teaching also at the university the course of protein engineering, and one of the first things that I say in my first lecture is that I tell the students, listen, you enroll to this course that talks about protein engineering, but in fact it's a bit misleading. We are more protein terrorists. We terrorize the proteins. We don't really know how to engineer them, because if you would go to the Technion or to MIT and you would study civil engineering, and your task would be to build a bridge.
Right.
You will be able to design, and whatever you will have in the blueprints, most probably when at the end of the job, you'll see, pretty much the same bridge that you designed. What we do in protein engineering is the analog of that would be, okay, we need to build a bridge over this river. So let's take stones, and let's take some metal rods and throw it over the river maybe 1 billion times, and once or twice we'll get something that will enable us to cross the river, but this is not really engineering. The beauty of genome editing is that for the first time, we can really call ourselves protein engineers. We can really engineer the genome and not just the genes.
Powerful statement, very powerful. Now that we've covered that, I would love to know, what is your vision for regenerative medicine?
Wow. I mean, regenerative medicine, for me, I passed 60, so I'm considered almost an old guy. So I start to think about, hey, what's going to happen next? And I think that for everybody, not just for me, but for everybody, it's exciting. Think about someone that is under dialysis and is begging for a kidney transplantation. And all of a sudden, no problem. You know, okay? We'll give you a brand new kidney,
Right.
or lung, or liver. You know, so that's to me, it's really exciting because so far the medical industry did wonderful in extending our life expectancy, but not necessarily the life quality. And regenerative medicine, for the first time, has the opportunity to really improve also the quality of life. And aesthetic medicine, well, not just quality of life, but we will look younger, you know, and beautiful. So that's exciting. I think it's really, you know, because at the end of the day, each one of us, you know, would like to feel good about himself,
Right.
To feel healthy, be able to do things that we've done when we were younger, and that's what this technology enables.
That is wonderful. I couldn't agree with you more. I'm a woman, of course, so
You are
it's
younger.
not.
You're still young. You don't think about it.
That is wonderful. So you mentioned earlier about patience, and I really like that. So I want to piggyback to what you think might be some other key consideration factors that will be important for sustaining innovation in the life science industry.
So I think everything starts with education. And today, unfortunately, some of the young people think that they actually don't need to go to the university. Everything is in the internet, and let's do a self-education and conquer the world. And I have my doubts about it, particularly in life sciences. Why? Because it takes much more. You need laboratories. You need to do the experiments, and not everything can be done virtually or by Zoom. At the same time, the university has to change because, admittedly, the academy is too conservative. And we've made big mistakes over the last 200 years. The reason I say it is because today, when you go to any university, and it doesn't matter if it's Harvard or Stanford or Hebrew University or Cambridge, it's divided to faculties, to departments, and people are specialized in something. And they become experts in very, very narrow field. And that's a big problem because when you need to solve an important problem, you need a toolbox, not just a screwdriver or a wrench. So the ability to collaborate, the ability to talk to scientists and understand out of your field, you know, and understand their language is something that we at the academy don't do properly. My hero are people like Leonardo da Vinci, you know, who was a biologist. He was also a chemist, was a medical doctor, was an engineer. Some people say that he was even a very good artist. And it's all in the same person. So the multidisciplinarity, the ability to look at science as a whole is something that we at the academy are still lacking. So we have to go back and learn from our ancestors and teach the students in a totally different way. I mean, the student of the future that in my mind will study computer science, physics, and chemistry, and biology, and design. Not just when he's undergraduate, but all the way until the graduation. These people will have the tools to really influence the innovation, because they will be able to innovate. Goes back to the first thing I said when we started our conversation. You can't innovate if you don't speak the language.
Exactly. This has been a masterclass in scientific excellence. So thank you for sharing your opinions. My final question is very simple. Do you have any other commentary or thoughts? The floor is yours to share any other opinions that you'd like for us to know.
So the one thing that I would like to say is that I thought a lot about sitting in the quarantine. I thought a lot about what happened to us since February or so, and I think that the world changed. This interview that we're doing right now is one of those things that happened. I can't think of of something so important that happened to us, that we were forced to become more digital.
Right.
And I think that brings a lot of information. But what you're doing right now is you enable sharing information all over the world, which is so important. Because a year ago, I would go to San Francisco to a meeting with 15,000 people, multiple sessions, and most probably I will find myself in one session, and at the same time there will be like 100 different sessions that I missed. And I'm not even talking about the cost and the flight and the time.
Right.
Of course, we're still missing the human touch. It's still we're not there. But I think that those kind of things that you're doing and others, the webinars, we will enjoy. This will be one of the things that will benefit us after this COVID-19 epidemic. And so I thank you actually for what you're doing.
Well, thank you for your kind words. It means a lot coming from you. I have the utmost respect for you and for CollPlant and for all the great work that you have done and will continue to do, because you are a brilliant mind indeed. And it's just been refreshing speaking with you today. So thank you.
Thank you very much, Sophia.